Alex and the Department of Labor are taking a major action that's been worked on for 4 months now, and now it's ready, to make it easier for small businesses to band together to negotiate lower prices for health insurance and escape some of Obamacare's most burdensome mandates through association health plans.
President Trump announcing the Labor Department's new initiative to help small businesses with the high cost of health care, association health plans. The plan brings people together to buy health care as a group, allowing small employers a better chance for health care advantages, customizable plans to tailor specific small business needs, and it reduces administrative costs and strengthens negotiating power with providers. That's the promise anyway. Here now to discuss it is Alexander Acosta, who's Labor Department Secretary. Thank you so much for joining us. So he said it today, you can band together, you can even go across state lines. Who would administer it then? If you have businesses kind of forming these loose organizations, somebody's got to do the negotiation. How would it work?
That's right, and the president explained it very clearly. Right now, large companies have so many advantages. They have economies of scale, they have bargaining power, and they actually have fewer regulations than the small businesses. And so under association health plans, small businesses can come together and form associations and negotiate for health care. So chambers of commerce across the nation, whether at the city level or the state level, or industry associations, the National Restaurant Association, for example, can form these associations and these groups and bargain for more affordable health care on behalf of thousands and thousands of members and their employees, and that's transformative.
But, you know, I don't know that associations like that, I mean, the way you describe it, have necessarily worked in the past. I was a member of the Screen Actors Guild. They had a health care plan altogether. It was the same kind of thing. If you're a member of a union, you had access to the plan. It may or may not be good. When you're talking about these smaller groups, if it's a community, like you said, is the government the one that's negotiating? You know, if it's a Chamber of Commerce, are they the one that's negotiating? Or if it's just a couple, you know, people in a loose association, does one of them elect someone to go do the negotiation?
Well, these associations are well known throughout the nation, chambers of commerce, industry associations, and you know, they have a very clear structure. And so all of these groups and associations can form a trust or within themselves can negotiate for health care. I'll give you an example, because this has been done before. One of the comments we received were from a husband and wife that were operating a small business. And before this, they had access to health care through an association. After Obamacare started, they lost that health care. Because of rule changes, these associations became much more difficult. So all we're doing now is saying those associations can once again flourish and provide health care to millions of Americans.
So it's a little bit travel back to what we had before. The biggest problem, though, is that there's no real price transparency or reality. I mean, for example, I go to the hospital and get a splinter removed. You know, the hospital says, well, that was $10,000. They tell the insurance company. Nobody ever pays that price. They've negotiated a discount that they pay, and then they're responsible for some. I pay another. The hospital forgets another piece of it, and it turns out that top line price wasn't a real price to anyone except for some poor schmuck off the street that came in and needed the care. I mean, that's like, it's that pricing at the point of service where so much of the problem is. How does this address that?
And there's certainly a number of issues that need to be addressed in the healthcare space, but that is one of the reasons why these associations are so valuable. Because as a group, as a large association of thousands of small businesses, they carry bargaining power, they carry scale. They can negotiate healthcare in a way that individual small businesses simply cannot. And that is why these associations in the past have been so valuable and will be valuable again. You know, the Congressional Budget Office is estimating that 4 million Americans will receive their coverage through these associations, including 400,000 who are currently uninsured.
Well, it sounds good so far. Secretary Acosta, let me move over to tariffs if I can, because that does have an impact on jobs in the United States and elsewhere. I got to start by saying we have one of the best job markets I've ever seen in my entire lifetime, and a lot of it is due to the credit of the administration with the tax cuts, with deregulation, et cetera. We now have more job openings than we actually have people looking for jobs, and that's about as close as you can get to full employment. So why do we need tariffs?
Well, you're absolutely correct. We have one of the best economies we have seen for decades. For the first time ever, as far as we've been keeping records, we have more job openings than individuals looking for jobs. And the Federal Reserve estimates the economy is going to get even better. But the president is focused on the long term. He wants this economy to continue. He wants these jobs to be preserved for Americans. And so he's saying, look, we need fair trade. And he's negotiating hard. But that is why Americans elected him.
But really, if you go back in history and you see why tariffs have been applied, it's usually to protect U.S. jobs. Well, as you just said, and I said, we have more job openings than we have people looking for jobs. So do we really need tariffs from a job standpoint?
We need tariffs from a fairness standpoint. The United States should engage in fair trade with its partners.
But there's a cost, not only a cost to the consumer we talked about before, but for all of those companies that use steel and aluminum is just one of the examples of a tariff that may be hurting U.S. companies. I mean, we have 10 times as many steel-using companies than we have steel-producing companies. It's a tenfold increase over the number of people who work for those companies. 900,000 people work for steel companies that use steel as opposed to 80,000 who work for companies that make steel. So shouldn't we focus on the first rather than the latter?
So 2 points. First, the president is clearly focused on jobs, and even more jobs. And that is so evident from this economy. 3.4 million new jobs since he was elected, a 3.8% unemployment rate, the lowest in decades. And, you know, at the G7 conference, the president made a really interesting suggestion, I think. He said, why don't we all just eliminate tariffs? And here's the question that I would leave with your viewers. Why don't we all just eliminate tariffs?
Well, that sounds good to me. That sounds like music to our ears. We're free traders. But at the same time, again, if you have to choose between industries that employ 900,000 people, those who use steel, and those who employ 80,000 people, those who manufacture steel, wouldn't you focus on the first rather than the second?
I think we should focus on what's fair to all Americans and how, in the long run, we put America in a position to grow and to thrive. And again, if countries as a group want to eliminate all tariffs, he suggested it. You know, they could take him up on that.